In a time of political chaos and global uncertainty, a new crisis emerged: the resurgence of polio in India and Africa. Nancy Pelosi, Speaker of the House and seasoned politician, found herself at a crossroads. Though her battles were often waged in the halls of Congress, this time she would be called to something far greater. Nancy was deep in the familiar grind of legislative negotiations. She thrived in the meticulous dance of politics, but her heart ached at the sight of the world's children suffering from preventable diseases. Polio had re-emerged in regions with fragile healthcare systems, sparking a health emergency. Although vaccines were available, logistical challenges and misinformation were preventing their distribution. As she scrolled through reports, late one evening, an image of a young child struggling with polio stopped her. The child's bright eyes, filled with both hope and despair, spoke to her soul. She knew she couldn't let bureaucracy stifle action any longer. A surprise visit from Dr. Anika Rao, a leading global health expert, changed everything. Dr. Rao pleaded for Pelosi's help. "You're one of the few leaders with the clout to rally nations and resources," she said. "If we don't act now, millions of children will be at risk." But this isn't just about funding. We need someone to deliver the vaccine and break the political barriers in India and Africa. "We need you." Nancy hesitated. She was a master of diplomacy, but no health expert. How could she, a politician, take on a global health crisis? Her staff advised against it, warning her about the risks of stepping outside her political domain. "Your legacy is here," one aide reminded her. But late at night, the image of the child haunted her dreams. Deep down, she knew she couldn't stay in her ordinary world. Seeking guidance, Nancy turned to her trusted mentor, former President Barack Obama, who had spearheaded global health initiatives during his presidency. Over coffee, Obama said, "You have the skills to negotiate with world leaders, and more importantly, you have the heart, but you won't be alone. Surround yourself with experts and allies. Believe in your ability to bring people together." With renewed resolve, Nancy embarked on her journey. Her first stop was Geneva, where she secured an emergency commitment from the World Health Organization. She gathered a coalition of health professionals, logisticians, and political advisors. The mission was clear: deliver the polio vaccine to the most vulnerable communities in India and Africa, and ensure its acceptance and distribution. The journey was fraught with challenges. In India, misinformation about the vaccine fueled by distrust in Western medicine threatened to derail efforts. Nancy worked closely with local leaders, including activists and religious figures, to dispel myths and build trust. She learned to adapt her political skills to cultural nuances, forging unlikely alliances. In Africa, logistical nightmares loomed. Poor infrastructure and ongoing conflicts made vaccine delivery perilous. Her ally, Dr. Kamara, a fearless doctor who had dedicated his life to eradicating polio, guided her through the region. Together, they faced warlords and navigated treacherous terrain, delivering vaccines to remote villages. But not everyone welcomed her mission. Powerful figures with vested interests in maintaining the status quo sought to sabotage the effort. Nancy narrowly escaped an ambush orchestrated by corrupt officials in one region. Undeterred, she pressed on. During one of her darkest moments, an unexpected ally appeared, a shimmering golden dragon named Solara. Ancient and wise, Solara had been watching humanity's struggle and chose to aid Nancy in her quest. "The world's children are its future," the dragon said, "and I will not stand idly by as they are lost." With Solara's help, Nancy gained a new edge in her mission. Riding on the dragon's back, she soared over mountains and deserts, delivering vaccines to regions otherwise inaccessible. The sight of the dragon inspired awe and hope among the people, breaking down barriers of fear and mistrust. The turning point came in a remote Indian village. Despite their efforts, a local leader refused to allow the vaccine, citing deeply rooted fears. Nancy decided to speak directly to the villagers. She shared stories of her own struggles, her belief in the power of community, and her commitment to protecting the future of their children. Her vulnerability and sincerity won them over. Word of her success spread, creating a ripple effect. Communities across India and Africa began to trust the mission. Vaccination rates soared, but the battle wasn't over. A sudden outbreak in a densely populated African city threatened to undo their progress. The team was short on vaccines, and time was running out. Nancy coordinated a daring airlift of supplies, personally negotiating with reluctant leaders to grant access to restricted zones. Solara flew through the night skies, carrying precious cargo to isolated areas. Nancy stayed on the ground, organizing efforts and ensuring every child was vaccinated. The experience pushed her to her physical and emotional limits. After weeks of tireless work, the tide began to turn. The outbreak was contained, and vaccination campaigns in both regions reached unprecedented success. Nancy's mission had saved countless lives, proving that global cooperation and determination could conquer even the most daunting challenges. Returning to the United States, Nancy was hailed as a hero. She brought with her not just stories of triumph, but a renewed sense of purpose. Her journey had shown her the power of stepping beyond one's comfort zone and embracing bold action. Her experience transformed her leadership. She became a vocal advocate for global health initiatives, pushing for policies that prioritized the world's most vulnerable populations. Nancy inspired others to see leadership not as a means to wield power, but as a responsibility to serve humanity. Nancy's mission left a lasting legacy. Polio cases plummeted, bringing the world closer to eradication. Her work sparked a global movement, uniting nations in a shared commitment to health equity. And as she addressed Congress, holding up a vial of the vaccine, she reminded the world, when we come together, there is no challenge we cannot overcome. Nancy Pelosi's journey became a beacon of hope, a testament to the power of courage and compassion in the face of adversity. And though she returned to the ordinary world, she was forever changed, a true hero who had saved millions and inspired countless others to follow her example.